My name is Jamaica Lovian, and today I will be talking about the impact of counseling services in higher education. With this being said, I'm going to analyze whether the implementation of student counseling services improves academic performance in college students. Seeking assistance from a counselor is a critical step in attaining scholastic prosperity. Therefore, it is essential to connect with one as soon as possible. The interaction between the faculty and students can directly influence an individual's success rate. In other words, forming a positive relationship can promote growth and development related to personal achievement. Students who have received feedback from school counselors displayed improved outcomes. Several researchers, Murphy, Rashley, and Timulask, have identified that all students can make advances by engaging with student counselors. The results of their study investigating feedback and the improvement of patient outcomes imply that there was not a statistically significant difference between the feedback and no feedback groups. Although the results may not be statistically significant, it is important to note that students receiving feedback showed a greater effect in comparison to those who refrained from feedback. Similarly, Reese, Norsworthy, and Rowlands carried out one of two studies that analyzed therapeutic feedback and treatment gains in 74 university students. Their findings suggest that students who completed and discussed outcome rating scale scores and session rating scale scores with their counselor presented 2 times the amount of improvement than the no feedback group. Thus, collaborating with counselors can help students get on the right track and alleviate specific hardships he or she may have. Mental health conditions among college students are extremely common. A research report examining the prevalence and age of onset of DSM-4 disorders found that 3/4 of lifetime psychiatric disorders begin at 18 to 24 years of age. Likewise, according to the World Health Organization's World Mental Health Surveys, generalized anxiety disorder, panic disorder, post-traumatic stress disorder, and mood disorders have an onset between the mid to late 20s, the ages typical of most post-secondary education students. An emotional demand that many college students may endure while attending college is stress. Thus, assessing the well-being of college students regularly can uncover relevant information in terms of thoughts, feelings, and behaviors that are experienced on campus. In 2006, a health assessment survey known as the American College Health Association National College Health Assessment was administered to 94,806 students from 117 colleges and universities in North America. The compilation of surveys found that stress is a primary barrier to academic success. Coping with stress can be difficult. However, there are various techniques that one can do to manage and reduce it. A common intervention that can be used to decrease stress and create beneficial outcomes is meditation. Two meditation management tools that counselors have used for students who undergo stress are mindfulness-based stress and the 8-point program. Those who received meditation as a means for treatment demonstrated a statistically significant reduction in stress. These results demonstrate that the implementation of meditation practices and programs will diminish stress among college undergraduates. The ongoing stress that college students face can potentially lead to psychiatric symptoms. One concern that researchers have is how these conditions affect academic performance in college. Eisenberg, Goldberstein, and Hunt have discovered a negative correlation between mental health conditions and academic performance. In other words, those who battled with mental health problems, particularly depression and anxiety together, were more likely to have a lower grade point average. On the other hand, the combination of anxiety and eating disorders were not associated to influencing GPA scores. It is meaningful to note that mental health conditions can contribute to unfavorable misfortunes in academics. Taking the steps to acknowledge and generate methods to reduce stress is imperative to attain favorable results in academics. Feeling overwhelmed by the continuous workload of school is normal for the majority of college students. One method that college counselors recommend to resolve this issue is time management. A time management behavior questionnaire revealed that setting goals and priorities, mechanics, planning, and scheduling, and perceived control of time influence academic achievements. Taking this into consideration, students who communicated that they had practiced managing their time wisely reported acquiring less stress. Those who have better control of their time will not only obtain less stress, but an increase in performance in school. Reducing stress strengthens academic performance and in turn can improve student retention. In 2000, Struthers, Perry, and Menick conducted a study to examine the relationships between academic performance, stress, motivation, and coping mechanisms in 203 college students. Through this analysis, researchers determined that there is an inverse relationship between academic performance and stress. More specifically, students who encounter minimal stress tend to perform better in academics compared to those who run into an immense amount of stress. Learning how to master personal development skills such as organization and time management can establish positive outcomes. With the help of campus counselors, students can excel in areas related to personal, professional, and academic development. Taking the initiative to meet with a campus counselor can lead to numerous benefits. Attending regular counseling sessions can produce therapeutic outcomes for all students. Counselors can also assist with stress and mental health conditions. In doing so, they can examine interventions to control and manage stress in ways that will not negatively affect academic performance. Therefore, students can perform to the best of their ability in school without any impediments. In conclusion, the implementation of counseling services does indeed improve academic performance in college students. This topic is relevant to my career because as a future nurse, I may encounter a time where I need to refer to counseling services while in nursing school. The academic workload will be extremely demanding. Therefore, referring to a campus counselor will provide me with the support that I need to persevere through school. In addition, he or she can help assist me with the current and future goals regarding school and important career decisions. With this being said, taking the initiative to build a relationship with a campus counselor will result in beneficial outcomes inside and outside the classroom.